Welcome to the Deep Dive. Today we're cracking open a fascinating mystery, one that quietly shapes every single choice you make. How your brain's hidden chemistry really dictates your rationality. Have you ever wondered why, even when you feel like your mind is clear, you might suddenly feel, surprisingly indecisive? Let me set the stage with a real-world puzzle. Imagine a 38-year-old software engineer. She's sharp, logical, thrives on problem solving. You know the type. She starts taking an SSRI medication for anxiety, and sure enough, her worry starts to ease up. But then something unexpected happens. She notices what she calls a dulled motivational energy, and she starts feeling indecisive at work. Decisions that once came swiftly now kind of bog her down in endless second-guessing. So here's the central question we're tackling. How can calming nerves, which sounds like an undeniable good, right? How can that inadvertently impair something as fundamental as decision-making agility? Why would boosting one specific chemical messenger, serotonin, in this case, seemingly sap someone of their drive, their crisp confidence? It feels counterintuitive, doesn't it?
But there's a profound logic behind it. In this deep dive, our mission is to unravel precisely how two really powerful neuromodulators, dopamine and serotonin, profoundly influence not just your mood, but your very rationality. Things like your confidence, your balance between patience and impulsivity, and even, your willingness to take risks. We're going to understand the subtle levers that control these crucial aspects of your cognitive functioning.
Exactly. And we'll do that by integrating, a truly comprehensive set of perspectives. We'll look at real-world clinical observations like the very scenario you just described with the SSRI. That's key. Then we'll zoom right in on the mechanistic neuroscience, peering into the specific brain circuits where these chemicals actually operate, get down to the nuts and bolts. And, especially for our analytical listeners, we'll layer on top of that some cutting-edge computational models, particularly this really powerful concept of the Bayesian brain to understand the core algorithms at play. The goal isn't just to explain what these chemicals do, though that's important. It's about how they fundamentally shape your decisions. Ultimately, you'll discover that dopamine, it drives reward and proactive behavior, kind of the go system, while serotonin promotes caution, inhibition, and tolerance for delay, more of a wait-and-see system. We'll even offer a practical tool towards the end, something we're calling a precision diary, to help you monitor and perhaps even calibrate your own decision processes based on these insights.
Okay, this is going to be an in-depth, really structured exploration designed to arm you, our listener, with a deeper understanding of your own internal decision-making system. Get ready to rethink what rationality truly means. All right, so to really get to the heart of this, let's unpack a foundational concept first. Neuromodulators. We hear a lot about neurotransmitters, of course, but what makes these chemical messengers like dopamine and serotonin fundamentally different? And, how do they actually work in the brain?
That's an excellent, really crucial distinction to make right from the start. Think of traditional neurotransmitters, chemicals like glutamate or GABA, as the brain's rapid-fire messaging system. They send precise, fast, point-to-point signals. They cause quick excitation or inhibition right at a specific synapse. It's like flipping a light switch on or off in just one single room. Very targeted. Neuromodulators, however, they operate on a much broader scale. They don't just send a single message, they actually change the overall state of the brain or large parts of it. Imagine them more like broadcasting signals throughout entire neural circuits. They subtly adjust the gain or the receptivity of those networks, how ready they are to fire, how sensitive they are. To use an analogy that might resonate with a systems thinking mind, which I know many of our listeners appreciate, if the brain is like a complex audio mixing board, right, where different neural pathways are like various instrument channels, these neuromodulators aren't just the individual notes being played, they're more like the control knobs for the entire board, adjusting the master volume, maybe the EQ, or adding reverb across multiple channels. They subtly bias the brain's decision-making algorithms. They influence how we process information, whether it's rewards or punishments or uncertainties. It's a much more pervasive effect rather than localized. They kind of set the general tone or the readiness for vast neural networks to respond. They're like the background operating system, subtly influencing every single app you run on top of it.
That control knob analogy is incredibly helpful, really paints a picture. Now, for the intellectually curious listener, here's where it gets truly interesting, I think. How does this idea of neuromodulators as control knobs tie into this highly sophisticated concept of the Bayesian brain hypothesis?
Yes, that's a really crucial connection. The Bayesian brain hypothesis suggests that our brains aren't just passive receivers of information, just sitting there waiting for input. Instead, they're active prediction machines. Your brain is constantly generating predictions about the world, forming hypotheses about what's likely to happen next based on all its past experiences and its internal models. Then, when new sensory evidence comes in, anything you see, hear, or feel, it's immediately compared against these ongoing predictions. And the difference between what you expected to happen and what actually happened, that difference is called a prediction error. These errors are absolute gold for learning. They're what your brain uses to update and refine its beliefs, basically making your internal models of the world more accurate over time. It's this continuous cycle: predict, observe, update, predict, observe, update. Now, this is where dopamine and serotonin come in as these true architects of rationality, as you put it. They are hypothesized to fundamentally tune the precision of these predictions and prediction errors.
Precision. What exactly does that mean in this context? Confidence.
Exactly. Precision is basically your brain's confidence in a signal. It's the inverse of variance, technically. Think back to that audio mixer analogy. If you have a very clear, strong input signal, say a pristine vocal track that's high precision, high confidence, you turn its volume up, right? Give it a lot of weight, let it heavily influence the overall mix. But if you have a noisy, unreliable input, maybe full of static, that's low precision, low confidence. You'd probably turn its volume down, give it less weight so it doesn't distort your final sound. In the brain, dopamine and serotonin are thought to sculpt our patterns of learning and choice by modulating different aspects of this precision tuning process. They effectively tell the brain things like, how much should I trust this new piece of information compared to what I already believe? Or how much weight should I give to a surprising reward versus a surprising punishment? This is absolutely fundamental to how we learn, how we adapt, and how we make choices in a world that is, let's face it, inherently uncertain. It's all about managing that uncertainty. #tech to dopamine reward, motivation, and model-free learning.
Okay, if we're thinking of these as control knobs, let's turn our attention to the first one. Dopamine. It's famously, perhaps a bit oversimplistically known as the reward chemical, but it's clearly far more nuanced than just pure pleasure.
Absolutely. Yes, it gets tagged as the pleasure chemical, but that's really missing the mark. While dopamine is indeed intimately linked with reward, its precise role is more accurately described as encoding reward prediction errors, or RPEs. And this is a crucial distinction. An RPE isn't just about experiencing the reward itself. It's about the difference between what you expected to happen and what actually occurred, the surprise element. So if you anticipate a small reward, maybe a little praise, but you get something much bigger, like a promotion. That's a positive RPE, a big positive surprise. But if you expect a reward, say you thought you'd get that promotion, but you get less or maybe nothing at all, well, that's a negative RPE, a negative surprise. And the activity of dopamine neurons, these cells located deep in the midbrain, directly reflects this calculation. It's quite elegant. When reality turns out to be better than predicted, these neurons fire in brief, intense bursts. Phasic firing, we call it. Conversely, when reality is worse than predicted, or maybe when an expected reward simply doesn't materialize, these neurons will actually pause their firing, dip below their baseline rate. So this dynamic phasic activity of dopamine isn't just about feeling good or bad. It serves as an incredibly powerful teaching signal for the brain. It essentially tells the relevant brain circuits, hey, that thing you just did or that situation you were just in, it led to something unexpected. Update your value system accordingly.
So it reinforces the good stuff.
Exactly. That burst of dopamine reinforces the specific behaviors, the thought processes, maybe even the environmental cues that led up to that positive surprise. And that makes you much more likely to repeat or even refine that strategy in the future. This is really the essence of reinforcement learning in the brain. How dopamine-driven plasticity, particularly in a key brain region called the basal ganglia, helps us learn from trial and error. It literally stamps in effective habits and what neuroscientists call model-free associations.
Model-free, what does that mean exactly?
Think of model-free learning as learning directly from raw experience without needing to build a complex mental map or a detailed simulation of how the world works. It's basically, this action worked well, got me a reward, so I'll do it again, or that path led to a bad outcome, so I'll avoid it. Very direct stimulus response learning. It's incredibly efficient for learning routine behaviors and habits.
Right, okay. But beyond just learning what works and what doesn't, dopamine clearly has this profound effect on our drive, our motivation, our sheer energy levels. What does the latest research say about that sort of pro-invigoration effect?
Yes, the research is quite clear on this point. Dopamine definitely has a potent pro-invigoration effect. It doesn't just teach you what to do, it also energizes the effort and increases your willingness to actually work for rewards. It gets you off the couch, so to speak. We see this consistently in human studies. There have been meta-analyses, these studies that combine data from many different experiments, like those led by Micheli and colleagues a few years back. They've shown that increasing dopamine, whether it's through medication or other means, consistently enhances not just reward learning, but also reward sensitivity. You become more attuned to rewards. And it also measurably increases vigor, meaning it makes us more energetic, faster, and more persistent in pursuing goals. You put more effort in. What's particularly fascinating, I think, is its impact on something called delay discounting.
Yes, the preference for now versus later.
Precisely. It's our natural tendency to value immediate rewards more highly than future rewards, even if the future rewards are objectively larger. You know, the classic, would you rather have $10 right now or $20 in a month? A high rate of delay discounting means you'd almost always grab the $10 now. You steeply discount the value of the future reward. But what's interesting is that increasing dopamine levels has been shown to reduce this delay discounting. It flattens the curve. This means people become more willing to wait for those larger future rewards rather than impulsively grabbing the smaller immediate ones. Dopamine seems to make the future feel a bit more valuable, relatively speaking. To give you a specific statistic from the literature, one large analysis that synthesized findings from over 100 studies, 107, I believe, reliably demonstrated that upregulating dopamine improved reward-driven behaviors across the board. It directly boosted participants' vigor, their speed and effort in responding for rewards, making them more energetic. And indeed, it made them slightly more patient, leading to less steep discounting of those future rewards.
That's really counterintuitive, isn't it? You think of dopamine as driving impulsive reward seeking, but here it's linked to more patience.
It is a bit counterintuitive at first glance, but it makes sense if you think about dopamine increasing the value or motivation associated with the larger future reward, making it worth waiting for. It's not just about immediate gratification.
Okay, and what about clinical observations? How does this play out when dopamine levels are disrupted in a disease state, or maybe specifically targeted by medical treatments?
Oh, clinically, the effects of dopamine dysregulation are quite stark and observable. Take Parkinson's disease, for example. It's fundamentally characterized by a severe deficiency in dopamine-producing neurons in a specific brain area. And what do patients with Parkinson's exhibit? Well, often akinesia, which is a profound difficulty initiating voluntary movements, and also apathy, a pervasive lack of motivation and emotional indifference. These symptoms directly reflect the critical role dopamine plays in galvanizing action, in providing that internal drive. Conversely, when dopamine levels are therapeutically enhanced, perhaps with dopaminergic medications like L-Dodafar, or sometimes with stimulant drugs in other conditions, we typically see an increase in energy, drive, and often even self-confidence. The individual feels more capable, more willing to take action, more engaged.
But there must be trade-offs, right? It can't all be positive.
Absolutely, there are always trade-offs. If dopamine activity becomes overactive or dysregulated, maybe due to medication side effects or in conditions like mania, it can sometimes lead to impulsivity, poor judgment, or even a kind of over-optimism that can veer into problematic territory. Furthermore, dopamine heavily influences our confidence calibration, how sure we feel. A surge of dopamine, perhaps after a string of unexpected successes, can induce a feeling of overconfidence, almost like being high on the brain's own reward system. You might become convinced you can do no wrong, take unwise risks. On the flip side, states of chronically low dopamine, as seen in Parkinson's or sometimes in depression, can breed debilitating doubt and a profound lack of initiative. Everything feels too hard, not worth the effort. So to sum up this part, you can really think of dopamine as the brain's primary go signal. It vigorously...
All right, now let's pivot and explore the other key player here, serotonin. This one is often discussed broadly in terms of mood regulation. You hear it constantly linked with depression and anxiety treatments. But it seems to have a very different, almost opposing role to dopamine when it comes to the nitty-gritty of decision-making, doesn't it?
Indeed, it does. If dopamine is largely about go, then serotonin, by contrast, is often associated with wait, or maybe even stop, in many important contexts. It's a very different flavor. It's deeply implicated in processes like behavioral inhibition, processing aversive or negative information, and yes, absolutely mood regulation. But its role in decision-making is quite distinct. Serotonin plays a critical role in our sensitivity to punishment and how we process threats. It helps us learn effectively from negative outcomes and, crucially, avoid harm. It's involved in that cautionary aspect of behavior. For instance, there's evidence suggesting that an increase in serotonin signaling can significantly heighten one's aversion to causing harm to others, or perhaps breaking important social norms. It acts as a kind of pro-social brake pedal.
A pro-social brake.
That's interesting. Is there direct evidence for that in humans?
Yes, there's some fascinating evidence. A well-known study by Molly Crockett and her colleagues back in 2010 provides a great example. They administered the SSRI citalopram, a common antidepressant that boosts serotonin levels to healthy volunteers. Then they put these volunteers through various decision-making tasks, including some tricky moral dilemmas. What they found was pretty striking. The participants who are on the SSRI became significantly more averse to personally harming others in these moral dilemmas. Even if that harm would lead to a greater good overall, like sacrificing one person to save five, they were less willing to do it. And in an economic game called the ultimatum game, where one person proposes how to split a sum of money and the other can accept or reject it, but if they reject, nobody gets anything. Those on the SSRI were less willing to punish an unfair offer if that punishment also inflicted a financial loss on the person making the offer. They seemed to prioritize avoiding causing harm, even if it meant accepting an unfair split themselves.
So they became less punitive, more harm-averse.
Exactly. Crockett interpreted these findings to suggest that serotonin promotes pro-social harm-avoidant choices. It seems consistent with a role in restraining aggressive or punitive impulses. They even noted the effect was strongest in individuals who were already highly empathetic, suggesting an interaction with personality.
Okay, so if dopamine makes us more patient for rewards by boosting their future value, does serotonin also affect our patience, but perhaps in a very different way, maybe through inhibition?
That's an excellent question, and the answer is yes. Serotonin strongly influences patience and impulsivity, but the mechanism and context differ significantly from dopamine's role. Generally speaking, higher serotonin levels tend to foster patience and increase our tolerance for delayed rewards, but likely by promoting inhibition and caution, rather than by directly enhancing the anticipation of the future reward itself. Conversely, low serotonin states are consistently linked with pushing towards more impulsive choices. We see this clearly in empirical studies. There's a technique called acute tryptophan depletion. Tryptophan is the amino acid precursor the brain uses to make serotonin, so depleting it temporarily lowers central serotonin levels. In one human experiment using this technique, by Schweihofer and colleagues in 2008, they found that when participants had temporarily lowered serotonin, their delay discounting curves became significantly steeper.
Meaning they wanted the reward now even more.
Precisely. They became much more likely to choose smaller, immediate rewards over larger, later rewards. They literally devalued future rewards more steeply, which is a classic hallmark of impulsive choice. It shortened their time horizon. And this finding aligns perfectly with what we often observe clinically. Low serotonin states, often seen in conditions like depression, certain anxiety disorders, or substance addiction, frequently correlate with increased impulsivity.
And the flip side? Boosting serotonin.
Right. On the flip side, enhancing serotonin signaling, like with SSRI medications, generally increases tolerance for delay and seems to reduce impulsive action. That meta-review by Micheli and colleagues we mentioned earlier highlighted this. They noted that serotonergic interventions like SSRIs tend to flatten those delayed discounting curves, making delayed rewards relatively more attractive or easier to wait for. The same review also confirmed that serotonin boosts often increase punishment sensitivity. This means we might become more adept at learning from losses or simply more inclined to avoid situations where loss is likely. So if dopamine is shouting, "Go get that reward, it's worth it," serotonin's strategy is often more like, "Hold on, don't rush for the quick reward. Let's make sure we avoid choices that might lead to bad outcomes. Wait, think, maybe inhibit this impulse." It's a very different message.
How does serotonin actually exert this braking effect at a more mechanistic level in the brain? What's happening underneath the hood, circuit-wise?
Mechanistically, serotonin's effects on behavioral inhibition are pretty well documented, down to the level of neural circuits. In both animal models and human studies, states of low serotonin consistently lead to difficulties in suppressing premature actions. This is sometimes called waiting impulsivity. For example, a 2014 study by Warb and colleagues found that tryptophan depletion in human participants significantly increased their rate of premature responding on a specific reaction time task. They simply couldn't withhold their response as effectively when they were supposed to wait. It clearly indicated a loss of inhibitory control over actions. Interestingly, though, that same study found this serotonin depletion didn't seem to affect their ability to value delayed rewards when asked about them in a questionnaire. This highlights a potential nuanced serotonin might be more involved in controlling impulsive actions in the moment, rather than just changing how we consciously value future rewards. Its roles can be context-dependent.
So it's more about stopping yourself from jumping the gun.
That seems to be a key part of it, yes. The overall pattern points to serotonin acting as a pervasive brake. It can slow down the initiation of actions, enforce waiting periods when necessary, and maybe broaden the time frame of consideration, which naturally leads to more future-oriented and deliberate choices. It also seems to have this fascinating dampening effect on immediate reward sensitivity, particularly in certain contexts. A very recent trial, just published in 2024 by Colwell and colleagues, directly increased synaptic serotonin in humans. They observed a reduced sensitivity to the outcomes of choices, especially in aversive or unpleasant contexts. What does that mean? Well, when things were uncertain or potentially negative, having more serotonin made people a bit less reactive to immediate rewards or losses that occurred. Furthermore, it specifically enhanced behavioral inhibition when participants felt under threat. They were more inclined to hold back to play it safe.
And that could explain some SSRI side effects, perhaps, like feeling a bit flat.
Exactly. These nuanced effects offer a deeper understanding of why SSRIs, while effectively reducing anxiety or depression for many, can sometimes have side effects like apathy or emotional blunting. By broadly reducing the salience, the emotional impact, of both negative and positive extremes to some degree, a high serotonin state can indeed produce emotional stability. But that stability might come at the potential expense of intense passion, spontaneous drive, or sharp reactions to immediate events. And beyond these specific actions on inhibition and reward punishment sensitivity, it's really crucial to acknowledge serotonin's broader influence on mood and our perception of uncertainty. Both are absolutely fundamental for rational decision-making. Serotonergic networks, which largely originate from these clusters of neurons called the RAFV nuclei in the brainstem, project incredibly widely throughout the entire brain. They modulate a vast range of functions: anxiety, mood, sleep, appetite, cognition, the list goes on. One really influential theory, proposed by Peter Dian and Quentin Hoons back in 2008 to 2009, posits that serotonin signals something akin to a long-term expected value or environmental adversity.
It's like a general weather forecast for the world.
Kind of, yes. It helps an organism establish a baseline bias for how promising or how dangerous the world generally feels right now. If dopamine signals the value of specific, immediate actions or cues, serotonin might convey a more sustained, generalized sense of background risk or potential loss in the environment. It's a slower, broader signal. And this theoretical framing has strong clinical connections. For example, individuals with lower serotonin function, perhaps due to genetics or chronic stress, often exhibit a pervasive bias towards expecting bad outcomes. That's a hallmark of the pessimism we see in clinical depression. Conversely, raising serotonin levels pharmacologically tends to alleviate this excessive focus on potential negatives, which helps explain why SSRIs are effective treatments for anxiety disorders, where people are often hyper-focused on potential threats. Computationally, some models describe serotonin as adaptively modulating the brain's learning rate, particularly for uncertain and especially aversive environments. So when outcomes are unpredictable or consistently bad, serotonin might step in and slow down the learning process. This effectively prevents knee-jerk overreactions to transient fluctuations or just random noise in the environment. It enables a more robust, stable, less reactive mode of operation, which is absolutely critical for long-term rational planning and avoiding being constantly whipsawed by minor setbacks. Micro recap 1.
Okay, let's take a quick pause here for our listener. We've laid some really important groundwork. We've established how these neuromodulators, dopamine and serotonin, act as architects, essentially tuning our brain's precision or confidence in different signals. We've explored dopamine as the go, signal driving reward-seeking, motivation, action, learning from good news. And we've contrasted that with serotonin, often acting as the wait stop signal, promoting caution, patience, inhibition, and learning from bad news or potential harm.
That's right. We've highlighted the core distinction and also hinted at the potential for these systems to pull us in different, sometimes opposing directions when we're faced with a decision. Understanding these individual roles is really the crucial first step before we dive into how they interact, which is where things get even more complex and interesting.
So we have the go and the wait stop. Dopamine pushing us forward, serotonin holding us back. It sounds like they're locked in this constant tug of war, kind of essential yin-yang dynamic in the brain, right? Is that the main story?
That classic view, that yin-yang dynamic, is very much still relevant and captures a huge part of the picture. From early computational models all the way through to modern psychological theories, dopamine and serotonin have often been conceptualized as representing these two fundamental axes of behavioral control. Dopamine drives appetitive motivation, that urge to approach, to acquire, to consume. Serotonin, on the other hand, is strongly associated with aversive restraint, the urge to withdraw, inhibit action, or exercise caution in the face of potential harm or punishment. So they absolutely do form a foundational yin-yang pair governing our fundamental approach versus avoidance behaviors. And there's considerable evidence supporting this functional opponency. For example, as we discussed, serotonin is strongly associated with behavioral inhibition, specifically when the brain predicts aversive outcomes. This is directly opposite to dopamine's primary role in driving approach behavior towards predicted rewards. An influential review by Barreau and Diane, which they aptly titled Opponency Revisited, really digs into this. They comprehensively analyze how dopamine's relentless push to seek reward is often counterbalanced by serotonin's capacity to induce withdrawal or caution, especially when there are potential punishment scenarios looming. This constant competition, this push and pull, is absolutely critical and plays out in countless real-world decisions. Think about any choice involving a risk-reward trade-off or conflicts between grabbing a short-term gain versus facing potential long-term negative consequences. That's often dopamine and serotonin battling it out.
But you hinted it's not always a simple opposition. Can they also cooperate sometimes, working together in more complementary fashion? Knowing the brain, it rarely seems to do anything in such a straightforward, completely binary way.
You're absolutely right to push on that. The brain's complexity rarely allows for simple binaries. While they clearly exhibit opposition in many crucial contexts, dopamine and serotonin also engage in really intricate cooperation and play complementary roles. It's not just a fight. For one thing, their underlying neural circuits are deeply physically interlinked. The dorsal rough nucleus, or DRN, which is the primary source of serotonin neurons in the brain, actually sends direct projections, like wiring, to key dopamine-producing regions. These include the ventral tegmental area, VTA, and the striatum. And importantly, it works both ways. Dopaminergic neurons also project back and influence serotoninergic areas. It's a two-way street. Recent circuit mapping work using really advanced techniques has provided fascinating insights into this direct influence.
Like specific pathways having specific jobs.
Exactly. For instance, a study by Zhu and colleagues in 2020 identified a very specific serotonin subcircuit. This pathway originated in the dorsal raphe nucleus, DRN, and projected directly to the ventral tegmental area, VTA. What they found was that this particular circuit played a key role in regulating an animal's susceptibility to social stress. When animals were exposed to chronic social stress, like bullying from a bigger animal, those with lower activity in this specific serotonin pathway were much more vulnerable. They exhibited depression-like behaviors. Conversely, if the researchers artificially activated this precise DRN-EVTA serotonergic circuit, it actually made the animals more resilient to the stress.
Wow, so serotonin was helping the dopamine system cope.
That's the incredible implication. In this context, serotonin, acting through this specific pathway, was actually facilitating the function of the reward circuit, the VTA dopamine neurons, to promote coping behaviors. It wasn't inhibiting the reward system, it was helping it maintain its normal firing and function even under stressful conditions, presumably by somehow attenuating the overwhelming impact of the stress-induced punishment signals. So think about it. Rather than always applying a brake opposite dopamine's accelerator, in this case, serotonin was effectively pressing the accelerator of a different car, a resilience car, perhaps. It was encouraging long-term positive behaviors like resilience and maintaining social engagement, even as dopamine might be spurring other immediate goals. This really reinforces that overall brain function emerges from a dynamic, integrated interplay. Dopamine and serotonin signals are not isolated forces. They're integrated across multiple circuits and brain regions. And the net effect on your behavior depends crucially on which specific receptors and which neural pathways are engaged at any given moment. It's all about context and specific circuitry. Now, from that Bayesian brain perspective we discussed, this complex interaction can be understood, at least in part, as dopamine and serotonin modulating different forms of uncertainty or precision within the brain's predictive models. Dopamine, as we establish, seems strongly linked to reward precision. It signals how much confidence we should have in our predictions about rewards. So, a high dopamine state might signify that reward cues in the environment are highly reliable, and therefore the system should confidently go ahead and exploit them. This means assigning high precision to reward prediction errors, driving robust learning and decisive action. Serotonin, on the other hand, might be encoding a different form of precision, perhaps related to environmental uncertainty or adversity. It could be adjusting how cautious the entire system should be overall. Consider this possibility. Under conditions of high serotonin, maybe when you feel content, safe, and perceive a low-threat environment, the brain might treat potential punishments or negative outcomes as less precise, less certain, or less urgent. This state allows for more exploration, more behavioral flexibility, and perhaps a greater tolerance for delayed gratification because the immediate risks seem lower. However, if serotonin levels are low, maybe during states of high anxiety or perceived conflict, the brain might effectively tighten the precision assigned to aversive signals. In this state, every potential loss, every possible negative outcome looms large and demands immediate attention. This would naturally make one more risk-averse, more hesitant, or prone to overthinking potential downsides.
So serotonin adjusts our caution level based on the perceived danger.
That's a key hypothesis, yes. And this concept beautifully dovetails with the idea that serotonin helps tune the brain's learning rate based on environmental volatility. Some chemogenetic studies in animals, where researchers can turn specific neurons on or off, have shown that silencing serotonin neurons can actually increase an animal's learning rate in rapidly changing environments. This makes them more reactive, more sensitive to very recent outcomes. Now, this could be adaptive if the environment is truly volatile and changing quickly, but it becomes maladaptive if it causes the animal to overreact to transient fluctuations or just random noise, mistaking temporary setbacks for fundamental shifts. We even see hints of this complexity in humans. Unmedicated patients with mood and anxiety disorders, conditions often involving serotonergic dysfunction, frequently show altered patterns of learning, especially when faced with uncertainty or negative feedback. So the ultimate takeaway here, thinking about balance, is that the right balance between dopamine and serotonin, which likely shifts dynamically depending on the situation, corresponds to a truly well-calibrated trade-off in your behavior. It's the trade-off between exploiting known rewards versus exploring new possibilities, or the trade-off between confidently trusting your prior expectations versus rapidly updating those beliefs with new, sometimes contradictory, evidence. And we can clearly see the pathologies that arise from an imbalance. If dopamine consistently dominates and serotonin is too low, an individual might become persistently overconfident, impulsive, and excessively risk-seeking. They're essentially overweighting potential rewards while dangerously underweighting potential dangers. Think mania, perhaps. Conversely, if serotonin consistently dominates and dopamine is too low, the individual might become excessively overcautious, chronically unmotivated, or deeply pessimistic. They're severely overweighting potential losses and uncertainties while failing to see or pursue opportunities for gain. Think severe depression or anxiety. Therefore, healthy rational control of behavior isn't about simply maximizing one chemical or minimizing another. It requires the dynamic and context-dependent tuning of both systems. You need the ability to increase dopamine's influence when proactive action is needed and the environment feels relatively stable and rewarding. But you also need the ability to skillfully dial up serotonin's influence in contexts that demand patience, careful forethought, inhibition of impulses, or where missteps could be genuinely costly and need to be avoided. It's a constant adaptive dance. Micro recap 2.
Okay, another checkpoint. We've just navigated the really complex dance between dopamine and serotonin. We've seen they're not just simple opposites, locked in combat. They could be opponents, yes, governing approach versus avoidance, but they're also collaborators, working together through specific circuits for things like stress resilience. They're finely tuning our response to rewards, punishments, and crucially, uncertainty.
Exactly. We've emphasized that this dynamic balance is absolutely key to optimal, rational decision-making, and we've started to explain how their interaction can be viewed through this powerful computational lens of precision weighting in the Bayesian brain. They're fundamentally biasing how we perceive and react to different signals coming from our environment and from within ourselves. This balance dictates our strategy. #TechCheck5. Precision tuning in the Bayesian brain, a computational lens.
All right, let's take an even deeper dive into these computational models now. This is fascinating, especially for our analytical listener. How does Carl Friston's predictive processing framework, which is a highly influential, almost unifying idea in theoretical neuroscience, provide a language for understanding these neuromodulatory effects, particularly through this concept of precision weighting?
Right. Carl Friston's predictive processing framework, along with related Bayesian models of brain function, offers a really powerful and potentially unifying language to describe how the brain constantly handles uncertainty, which is, let's face it, its main job. In the mathematics of Bayesian inference, precision is a fundamental concept. It's technically the inverse of variance, but in plain terms, it represents our confidence or certainty in a given signal or belief. The brain, according to this framework, is constantly engaged in this probabilistic dance. It has to decide, moment by moment, how much trust or weight to place on new incoming sensory evidence versus its existing established prior beliefs about how the world works. Which signal do I believe more, my eyes or my expectations? And this is exactly where neuromodulators like dopamine and serotonin are hypothesized to step in. They are believed to be the biological mechanisms that fundamentally modulate this trust, this precision weighting, at various levels of the neural hierarchy.
So they're setting the confidence levels for different inputs.
Precisely. They mediate this precision weighting. For example, think about attention. When you attend intensely to something, focusing your cognitive resources on a particular sensory channel, like listening closely to one voice in a noisy room, that process can be computationally viewed as increasing the precision assigned to that select sensory input. You're essentially telling your brain, this signal is important, trust it more. Dopamine, particularly working in concert with another neuromodulator, acetylcholine, has been specifically proposed to enhance the precision of reward-predicting cues and other highly salient, important stimuli. This makes them stand out more in our perception and more strongly influence our subsequent action choices. Serotonin, conversely, might be more involved in modulating the precision assigned to our predictions about long-term outcomes, or perhaps potential threats, or even the overall uncertainty of the environment. This could manifest behaviorally as altering how much an organism explores new options versus exploits known ones, or how much randomness, sometimes called temperature in reinforcement learning terms, is introduced into its choice policy. This influences its behavioral flexibility and caution.
Wow. So it really sounds like they're literally adjusting the fundamental parameters of our brain's learning algorithms. They're not just triggering a specific response. They're fundamentally changing how we learn and respond to future information.
Exactly. That's a perfect way to put it. Diane and Hughes, in their really seminal 2015 work looking at neuromodulators through the lens of computational psychiatry, explicitly emphasized this role as metaparameter control. They argue that these neuromodulators are absolutely crucial for controlling the higher-level parameters, the settings, if you will, that govern the brain's core learning algorithms. Think about the dilemma the brain constantly faces. Sometimes it needs to learn very slowly and steadfastly stick to its established beliefs, resisting minor fluctuations or noise in the environment. Think stable, predictable world. But other times it needs to update its beliefs very quickly and flexibly, especially when the world clearly changes or something unexpected and important happens. Think volatile, unpredictable world. Neuromodulators are proposed as the biological mechanism that helps resolve this critical dilemma. They do it by dynamically adjusting the gain on prediction errors, how much impact those errors have. They effectively tell the system when to learn strongly from a discrepancy between prediction and reality, and when to perhaps ignore that discrepancy as likely being mere noise or unimportant variation.
Adapting the learning rate itself.
Precisely. Adapting the learning rate and other key parameters. In their specific formulations for computational psychiatry, serotonin is often cast as a key modifier of learning, particularly under aversive or highly uncertain conditions. It might dial down the learning rate when things are confusing or negative, preventing overreactions and promoting stability. Dopamine, on the other hand, is more often seen as modulating learning under rewarding conditions, amplifying the impact of positive prediction errors to ensure we learn effectively from success. And it's crucial to remember, these systems don't operate in isolation in some abstract computational space. They intricately interact with both cortical circuits, involved in higher-level thought, and subcortical circuits, involved in more basic drives and habits. As one extensive review article eloquently put it, this whole idea of modulation of prediction errors via precision weighting is nothing more than modulating the gain, postsynaptic sensitivity, or excitability of appropriate neuronal populations.
So in simpler terms,
in plain language, what this means is that neuromodulators adjust how loud or how persuasive certain prediction error signals are in the brain's ongoing internal negotiations about what to believe and what to do. Serotonin, for instance, might effectively turn down the volume on noisy, uncertain cues like sporadic losses in a game or ambiguous negative feedback from a colleague to prevent us from overreacting, becoming excessively anxious, or abandoning a good long-term strategy prematurely. Conversely, dopamine turns up the volume on reliable reward cues, ensuring that we don't miss out on important opportunities or fail to reinforce genuinely beneficial behaviors. And when this intricate precision tuning system goes awry, when the balance is off, that's precisely where we start to see the emergence of psychopathologies. For example, if the brain somehow sets the precision on random negative events too high, a person may develop chronic anxiety or even learned helplessness. They start seeing meaningful patterns and threats even in random noise. This is a plausible computational mechanism underlying symptoms observed in depression or perhaps even paranoid ideation. In fact, the idea of aberrant precision control, or misestimated precision, has been proposed as a potentially unifying theme across various forms of psychopathology. Many different disorders could, in principle, be framed as the brain failing to correctly estimate or assign precision, either globally or within specific circuits or domains. Now, bringing this back to our core topic of rational decision-making, especially for you, our analytical listener, rational decision-making itself can fundamentally be viewed through this lens as achieving optimal precision control. A truly rational agent, computationally speaking, should be competently decisive when the evidence supporting a choice is strong and unambiguous that corresponds to assigning high precision to reliable sensory input or accurate internal models. But critically, that same rational agent should be appropriately uncertain and cautious when the evidence is weak, ambiguous, or noisy. In those cases, they should rely more heavily on their prior beliefs or perhaps engage in exploratory actions to gather more information, effectively downweighting the unreliable current evidence. Dopamine and serotonin, as we've seen, are deeply involved in setting these very conditions, in tuning this balance between conviction and doubt.
So our feeling of confidence itself might be a reflection of this.
That's a very strong hypothesis. Our subjective feeling of confidence or doubt about a decision, a belief, or a prediction likely stems directly from this intricate dopamine-serotonin interplay, reflecting the precision weighting currently assigned to our internal models. If you feel highly confident and certain about something, that could reflect a brain state where high precision is being assigned to your internal model's predictions, perhaps indicating a degree of dopaminergic optimism about the expected outcome. You trust your model. If, however, you feel persistently doubtful, hesitant, or unsure, your brain might be operating in a mode where low precision is assigned to those same predictions, possibly a serotonergic caution signal urging you to second guess, gather more data, or reconsider. You don't fully trust your model right now. And critically, neither state is inherently better or more rational in an absolute sense. The key is whether your level of confidence is calibrated, meaning it accurately matches the actual probability of being correct given the evidence, or if it's biased high or low. This understanding actually provides a powerful tool for metacognitive insight, for thinking about your own thinking. An INTJ-like rationalist, for example, with their penchant for self-analysis and optimization, might learn to recognize internal states and adjust accordingly. For instance, I'm feeling extra anxious today, perhaps indicating a low serotonin tone relative to my baseline, so I'm probably overweighting worst-case scenarios in this decision. I should be careful not to miscalibrate the actual risk. Or, on another day, okay, I'm definitely riding a dopamine high from those recent project successes, which might be making me feel overconfident about this new venture. Let me deliberately seek out counter-arguments and double-check my reasoning with extra rigor. This kind of self-reflective adjustment, this conscious compensation for one's current perceived neuromodulatory bias, is essentially engaging in real-time thinking about one's own precision weighting. It's using rationality to manage the biological substrate of rationality itself. Micro recap 3.
All right, let's pause again. We've just delved into the computational heart of this, really understanding how dopamine and serotonin aren't just triggering feelings, but are literally tuning the precision, the confidence level of our brain's predictions. And this affects everything from how we learn from rewards and punishments to how much we explore, to even how confident or doubtful we feel about our own judgments. It's incredibly deep.
Absolutely. This perspective highlights that rationality isn't just about pure disembodied logic. It's profoundly shaped by how our brain's underlying chemical parameters set the stage for our thought processes. The ultimate goal, from this viewpoint, is achieving optimal precision control, knowing when to be confident and act decisively, and when to be cautious, reflective, and open to revision. It's about calibrated confidence. #6. Clinical Vignette revisited the SSRI and the executive.
That was incredibly illuminating on the theoretical side. Let's bring all this sophisticated understanding back down to earth and revisit our software engineer, the executive we introduced right at the beginning. With all this new theoretical background, her puzzling experience with the SSRI makes so much more sense now, doesn't it? The paradox truly begins to dissolve.
Absolutely. It really clicks right into place now, doesn't it? Her increased serotonin levels resulting from the SSRI medication were clearly effective in achieving the primary goal, reducing her anxiety and perhaps lifting depressive symptoms. Computationally, you could say it successfully toned down the precision or gain on her brain's internal fear predictions. That's the therapeutic effect. But as we've extensively discussed, serotonin has much broader influence across the brain. And in her specific case, it also seemed to significantly dull her motivational drive for get up and go. Within our framework, the SSRI likely raised the goat on her brain signals related to long-term safety, contentment, and maybe satiation. This made her feel more at ease with the current situation, less disturbed by potential future threats or uncertainties. That's good for anxiety. Simultaneously, however, it seems to have somewhat dampened the salience or impact of immediate reward-related signals. This aligns with what many patients on SSRIs report clinically, sometimes describing it as a whatever effect or feeling a bit flat. It's a general reduction in the intensity of both negative and positive emotional extremes,
leading to the indecisiveness at work.
Exactly. For our engineer, this meant that decisions at work, particularly those requiring quick, confident action, initiative, and maybe a proactive stance towards potential gains or opportunities, became much harder. Her brain simply wasn't producing the same robust, phasic dopamine bursts in anticipation of potential rewards or successes. The landscape of incentives felt flatter. Instead, her now more serotonin-influenced brain was likely urging caution, perhaps implicitly asking, "Are you really sure this is the right move? Let's not rush things. Maybe delaying action or even doing nothing is the safer option right now." The predictable result was precisely what she reported: increased indecision and a noticeable slowness in her professional life.
And can we map her specific complaints onto the research findings we've discussed?
Yes, we can map them very directly. Consider her statement, "I just can't get excited about new projects like before." This resonates perfectly with research findings suggesting that SSRIs can indeed reduce sensitivity to rewards. For example, some neuroimaging studies show blunted neural responses to positive feedback or reward anticipation in patients on SSRIs. And as Crockett's work demonstrated, increased serotonin can bias individuals away from aggressively pursuing certain types of goals, perhaps making them less motivated by individual gain. Similarly, her observation, "I don't feel the urgency to chase deadlines, I kind of just let things happen," strongly suggests a marked enhancement of delay tolerance and a diminished sense of dopamine-driven urgency or vigor. Her brain had effectively shifted into a more serotonergic mode. Plenty of patients, perhaps less anxiety about the future, but noticeably lower on spontaneous passion and proactive drive. While this shift clearly protected her from the chronic stress and anxiety she was experiencing before a significant benefit, it came with these significant trade-offs: less spontaneous initiative, perhaps reduced creativity, and this general flattening of the incentive landscape. When everything feels sort of equally fine, the intrinsic motivation to hustle, innovate, or push hard naturally diminishes.
Okay, so knowing all of this, how might she or anyone else experiencing something similar begin to consciously calibrate this delicate balance between drive and caution? Are there practical steps one can take beyond just stopping the medication, which might bring the anxiety back?
Absolutely. The beauty of understanding these underlying mechanisms is that it immediately points towards potential interventions, spanning both pharmacological adjustments and behavioral or cognitive strategies. For instance, in therapy, or perhaps through coaching, one might work with her to consciously reintroduce some dopaminergic spark into her daily routines. This could involve cognitive behavioral strategies focused on setting small, achievable goals and then deliberately acknowledging and internalizing their completion. The aim is to provoke those internal positive reinforcement signals, the RPEs, even for small wins. These aren't necessarily about external rewards, but about cultivating an internal sense of accomplishment and progress that can naturally stimulate dopamine release. Alternatively, from a pharmacological perspective, her prescribing doctor might explore options like carefully adjusting the SSRI dosage, or perhaps considering adding a medication with a different mechanism, maybe a dopaminergic agent. For example, atypical antidepressants like bupropion, which primarily works on dopamine and norepinephrine systems, are sometimes added to SSRIs precisely to counteract side effects like low motivation or sexual dysfunction, attempting to biologically restore some of that balance.
So you have different ways to tackle it: changing the brain chemistry directly, or training the brain's responses.
Exactly. This really underscores a key point. Pharmacological interventions and cognitive behavioral techniques represent different, yet potentially complementary leverage points on this complex neuromodulatory balance. Medication directly pushes the levels or activity of neuromodulators, often resulting in broad systemic effects, as we see with the potential whatever effect, or emotional blunting sometimes associated with SSRIs. It's a blunt instrument in some ways. Cognitive behavioral techniques, on the other hand, work by selectively training the brain's responses, habits, and associations, leveraging its natural plasticity. You're teaching the system to react differently. For example, we know that mindfulness meditation practices have been shown to increase patience and reduce impulsive reactions, potentially by strengthening top-down cognitive control pathways that might involve serotonin-mediated inhibition. This is effectively a behavioral way to enhance serotonergic functions like restraint and deliberation without needing a pill. Conversely, structured reward-based habit training, maybe using productivity apps that celebrate milestones or provide virtual trophies, can be used to deliberately boost dopaminergic engagement in specific tasks. It acts as a kind of targeted behavioral dopamine drip, reinforcing desired actions.
And her case also seems to highlight the complexities of confidence calibration, doesn't it? How SSRIs might shift that.
Yes, absolutely. It throws a fascinating spotlight on how shifting mood states, driven by neuromodulator changes, can impact confidence calibration. Before starting the SSRIs, her chronic anxiety likely caused her to be chronically underconfident. She would probably second-guess herself constantly, plagued by what were essentially false alarms generated by her overactive fear circuits. Overly high precision on threat signals, perhaps. However, once on the SSRIs and feeling calmer, she might paradoxically experience a different kind of confidence imbalance. Perhaps becoming overconfident in certain areas, maybe too comfortable with inaction, or developing a passive belief that things will just work out okay without her needing to exert much proactive effort. Underestimating risks, perhaps. Neither extreme chronic self-doubt or passive complacency is ideal for truly rational decision-making and effective functioning. The goal, always, is to find that well-calibrated middle ground where she can enjoy the relief from debilitating anxiety without losing her critical motivational edge and the ability for appropriate self-assessment.
That makes sense. And what about risk-taking in this context? How might the SSRI have influenced her willingness to take risks?
That's another crucial dimension. Let's consider a plausible scenario. Suppose that off medication, our engineer was inherently risk-averse, maybe hesitant to present bold new ideas at work or take on highly challenging projects because of her underlying anxiety. But once on the medication, her fear is significantly toned down. As a result, she might actually become somewhat more open to taking risks she previously would have avoided. SSRIs in some individuals can reduce behavioral inhibition to the point where they might take social risks, like speaking up more, or even financial risks, perhaps investing more boldly, that they wouldn't have considered before. Sometimes these risks turn out to be positive and lead to beneficial outcomes. Maybe she finally asked for that raise. But other times, reduced inhibition could lead to oversights or poor judgments if the caution signals are overly dampened. The relationship between mood and risk perception is indeed complex and well studied. Depressed moods generally tend to correlate with heightened risk aversion, except sometimes in moments of sheer desperation. This is often accompanied by pessimistic probability weighting, where negative outcomes seem much more likely than they objectively are. Conversely, a manic or hypomanic mood typically correlates with strong risk-seeking behavior and overly optimistic biases about potential gains. Our engineer wasn't manic, of course, but her chemically altered mood state, induced by the SSRI, could certainly shift her personal risk calibrations in subtle but significant ways. And this is precisely where keeping something like that precision diary we mentioned earlier would be incredibly valuable for her. By tracking her mood, energy, decisions, and risk-related behaviors over time, she might uncover revealing patterns. For instance, on days when I feel extra calm and content, perhaps reflecting high serotonin tone, I notice I tend to delay important decisions too long, maybe missing out on timely opportunities. Or conversely, on days when I feel a bit more upbeat, maybe slightly stressed, possibly indicating a different neurochemical balance, serotonin slightly down, dopamine or noradrenaline up, I find I'm much more productive and decisive, but maybe I should double check if I'm being impulsive. Recognizing these personalized patterns offers crucial clues for adjusting her strategy day to day, allowing her to consciously counteract these subtle chemical biases and make decisions that are more consistently rational and aligned with her long-term goals. Micro recap for...
Okay, fascinating. We've brought our theoretical understanding right back to the real world with the engineer's story. We can now clearly see how a shift in this delicate neuromodulatory balance, often induced by medication, but also by life events or even lifestyle, can profoundly alter not just mood, but also fundamental aspects like drive, decisiveness, confidence calibration, and even risk perception.
Exactly. Her case beautifully illustrates the practical implications of this concept of precision tuning. It demonstrates how interventions, whether pharmacological like SSRIs or behavioral like cognitive strategies, can effectively recalibrate our internal decision-making system. It really highlights that optimizing our decisions often involves not just logical analysis, but also understanding and managing these powerful underlying chemical undercurrents that shape our perception and motivation. #7 Insights from key studies, expert analysis.
To really solidify our understanding now, and perhaps satisfy the deep curiosity of our listeners who appreciate getting close to the source, let's go directly to some of the pivotal research papers and theoretical contributions that form the bedrock of our knowledge about these complex dopamine-serotonin interactions. These studies don't just inform the theory, they really illustrate the precise mechanisms at play.
Absolutely. Diving into some key studies can really crystallize these concepts. Let's look at a few critical works that have shaped the field. First, let's revisit Diane and Hayes, 2015, focusing on neuromodulators in computational psychiatry. Peter Diane and Quentin Hayes have been incredibly influential in rigorously framing how neuromodulators like dopamine and serotonin can be understood through the quantitative lens of computational models, especially models of decision-making under uncertainty, and how these processes might go awry in psychiatric conditions. In their highly cited 2015 review, they really elaborate on how these neuromodulatory systems act to finely tune the metaparameters of our brain's underlying learning and decision algorithms. A core concept they explore extensively is this idea of precision tuning, which we've discussed quite a bit. They emphasize that the brain constantly needs to flexibly allocate precision, essentially, confidence or weight to different prediction errors, based on the current context and goals. Neuromodulators, they argue persuasively, provide the crucial biological means to achieve this flexible control. They do it by modulating neuronal gain, how strongly neurons respond, and synaptic plasticity, how readily connections between neurons change. They apply this framework brilliantly to understanding conditions like depression. They frame depression not just as sadness, but as a specific kind of decision-theoretic problem. They propose that serotonin dysfunction in depression could lead to the formation and maintenance of maladaptive pessimistic beliefs. Computationally, this isn't just a vague feeling. It could mean the brain is systematically overweighting negative prediction errors, giving far too much importance and learning signal to bad outcomes, or conversely, systematically underweighting positive prediction errors, failing to properly register or learn from good news. This would computationally correspond to a person persistently expecting bad outcomes and failing to update those negative beliefs even when positive events occur. They describe it almost as a state of stuck precision on gloom, where the brain rigidly holds on to negative expectations. Dopamine, too, plays a critical role in their computational model of depression. If dopamine signaling is underactive, it fails to effectively propagate reward predictions throughout the relevant brain circuits. This means the depressed individual might not properly learn from, anticipate, or even seek out potentially rewarding experiences, contributing directly to symptoms like anhedonia, the inability to feel pleasure, and emotivation, lack of drive. So their work powerfully reinforces the idea that rational control and its failures in conditions like depression isn't solely about abstract logic or conscious willpower. It is fundamentally biologically instantiated and regulated by these chemical systems that set the very context, the priors, and the learning parameters within which our deliberations and choices unfold.
That's a really powerful reframing of depression. What about understanding serotonin itself better? You mentioned it's not monolithic.
Exactly. That brings us to another crucial line of research, exemplified by work from labs like Deepti Chaudhry's and specific findings like those in Zhu Al, 2020, which reveal the importance of serotonin subcircuits and behavioral control. For a very long time, as you said, serotonin was viewed somewhat monolithically, often just labeled the mood chemical. But the research, especially using modern neuroscience tools that allow for circuit-level analysis, has evolved dramatically. We now have a much more nuanced understanding that there isn't just one serotonin system. Instead, there are distinct populations of serotonin neurons, even within the Raphi nuclei, that project to different brain regions and control surprisingly specific functions. Chaudhry's work and studies like the Zhu at a 2020 paper we discussed earlier are at the forefront of dissecting these specific pathways and rigorously examining how manipulating particular subsets of serotonin neurons affects specific behaviors, like response to stress. Remember that finding? They identified a distinct DRN-AVTA serotonergic circuit. This specific pathway, running from the dorsal Raphi nucleus, serotonin's main source, directly to the ventral tegmental area, a key dopamine hub, was found to critically regulate an animal's susceptibility to social stress. When this specific circuit was inhibited, animals became much more vulnerable to stress, and activating it made them more resilient. Crucially, these serotonin neurons seemed necessary to keep the dopamine neurons firing normally even when the animal was under duress. This is a profoundly important insight. It means serotonin's effect on behavior, including aspects relevant to rational control like stress coping or motivation, can be incredibly circuit-specific. The very same molecule, serotonin, released from different neurons onto different targets, can either enhance or dampen go-getting behavior depending entirely on which specific circuit is engaged. Chaudhary and others emphasize this concept of needing precision at the circuit level for understanding neuromodulation. They argue that future therapeutic interventions really should aim to target the precise 5-HT subsystem involved in a particular symptom, rather than broadly flooding the entire brain with serotonin, which is essentially what current SSRI medications do. Imagine if future treatments could boost serotonin selectively, say, only in the prefrontal cortex to improve cognitive flexibility, or perhaps only in the nucleus accumbens to specifically enhance the processing of social rewards. That's the future direction. So this line of research cautions strongly against any simplistic, one-size-fits-all thinking when it comes to neuromodulators and rationality. It powerfully reminds us of the brain's inherent modularity and specificity. Rational decision-making in a social context might rely on a completely different serotonin circuit than, for instance, making decisions about physical danger, resource acquisition, or delaying gratification. The crucial takeaway is, serotonin is many things, and asking which serotonin pathway is primarily at play here is critical for truly understanding any given behavior or mental state.
Fascinating. And you mentioned Molly Crockett's work on morality earlier. How does that fit into this picture of rational control? Morality seems like such a high-level concept.
Yes, let's circle back to Molly Crockett's work, particularly around 2012, on serotonin and moral decision-making. Her research provides a truly captivating bridge between the low-level world of neuromodulation and these highly complex, often abstract, rational behaviors like making moral judgments. We briefly touched on her key PNAS study earlier. Just to recap, she gave healthy volunteers the SSRI citalopram, boosting their serotonin, and found they became significantly more averse to personally harming others in hypothetical dilemmas. They were less likely to endorse actions like pushing someone off a bridge to stop a runaway trolley, even if it saved more lives overall, the classic utilitarian calculation. They also became less punitive in the ultimatum game, rejecting unfair offers less often, seemingly to avoid causing financial harm to the proposer. Crockett interpreted these results compellingly, suggesting that serotonin directly enhanced harm aversion and perhaps promoted social affiliation or peacekeeping. From a rational control or decision theory perspective, you could say that the increased serotonin effectively reweighted the value function used in their decision-making process. Actions involving direct harm or the prospect of causing pain to another person seemed to receive an extra negative weight in their internal calculus. This is consistent with serotonin enhancing the signaling of negative outcomes or punishments, particularly social ones. Conversely, perhaps fairness violations themselves received relatively less negative weight, as retaliating against unfairness by rejecting the offer would itself cause harm, financial loss to the other person. It's almost as if the temporary increase in serotonin implemented a subtle, perhaps unconscious moral policy tilt within their brains a bias towards avoid causing pain, even if it comes at a personal cost or violates abstract fairness principles.
Which raises that really provocative question. Is that behavior more or less rational?
Exactly. That's the philosophical pickle it puts us in. Is prioritizing harm avoidance over utilitarian outcomes or personal gain more or less rational? The answer, as with so many ethical dilemmas, depends entirely on your predefined goal function or what you consider the ultimate objective. If your goal is purely maximizing immediate self-interest or adhering strictly to a utilitarian calculus, then maybe accepting an unfair offer or refusing to sacrifice one for many seems irrational. But if your goal includes maintaining social harmony, minimizing interpersonal conflict, or avoiding personal guilt associated with causing harm, then those same choices could be perfectly rational according to that set of values. These findings are profound because they highlight how neuromodulators can subtly, yet powerfully, shift even our high-level decision policies, including moral ones, simply by changing the subjective weight or value we assign to different potential outcomes. And this gives real credence to the idea that by understanding your own current neuromodulatory state, perhaps through self-monitoring or recognizing the effects of substances or stress, you might actually be able to predict certain biases in your own complex decisions. For example, if you're aware you've recently taken a serotonin-boosting supplement or are feeling particularly calm and affiliative, you might anticipate potentially becoming more forgiving or perhaps overly cautious in a negotiation. A truly rational agent, aware of this potential bias, could then consciously compensate for it or at least better understand the underlying biological drivers shaping their own choices and judgments. So, to summarize this section on key studies, the primary literature, whether it's computational modeling, circuit neuroscience, or human behavioral experiments, consistently underscores a growing mechanistic clarity. Dopamine and serotonin aren't just vague influences, they actively shape decision-making at precise algorithmic and circuit levels. And when their activity is perturbed, either experimentally or clinically, it yields predictable, even if sometimes subtle, changes in how we value options, control our impulses, and even make moral judgments. For rationalist-minded individuals, these accumulating insights act almost like a developing cheat sheet for introspection. They provide a powerful framework for understanding which internal dials have likely been turned in our own brains when we notice shifts in our decision patterns, motivations, or confidence levels. End of chapter mega recap plus flashcard bullet list.
Wow, that was a truly deep dive into the foundational science. We've covered a huge amount of ground, from brain circuits to computational models to specific studies. Before we pivot towards practical application, let's take a moment to really crystallize these core insights for everyone listening.
Absolutely. Let's pull it all together. We started by establishing that neuromodulators like dopamine and serotonin act as crucial control knobs or architects within the brain. Unlike standard neurotransmitters that send fast point-to-point signals, these chemicals tune the overall state of neural circuits. We then frame this tuning through the lens of the Bayesian brain hypothesis, where these neuromodulators adjust the precision, the confidence or weight given to different signals, like prediction errors versus prior beliefs. This is fundamental to learning and adaptation. We dove deep into dopamine, identifying it primarily as the brain's go signal. It encodes reward prediction errors, driving motivation, energizing behavior, vigor, reinforcing successful actions through model-free learning, and even influencing patients by making future rewards seem more attainable. It's strongly linked to confidence, but dysregulation can lead to impulsivity or apathy. Then we explored serotonin, often acting as the wait stop signal. It promotes behavioral inhibition, increases sensitivity to punishment and harm, fosters patience, likely through enhanced inhibitory control, and helps us learn from negative outcomes. It's crucial for mood regulation and seems to signal broader environmental adversity or uncertainty. Boosting it can increase caution and harm aversion, sometimes at the cost of drive. Crucially, we examine their interaction. While often opposing approach versus avoidance, dopamine and serotonin also cooperate through specific interconnected circuits, influencing things like stress resilience. Their dynamic balance is key, determining the trade-off between exploiting known good things and exploring new possibilities. We saw how imbalances in this system, or miscalibrations in precision weighting, are increasingly implicated in various psychopathologies like overweighting negative events in depression or potential overconfidence in manic states. Healthy rationality requires optimal, calibrated precision control. Finally, we reviewed key research showing these effects are measurable, circuit-specific, and can even influence high-level decisions like moral judgments, underscoring the profound link between our brain chemistry and our cognitive functions.
That's a fantastic synthesis. Now, for you, our listener, especially if you appreciate structured knowledge for maximum retention, here are the key takeaways from this entire journey, distilled as if they were flashcards. Flashcard 1, neuromodulators as precision tuners. Think of dopamine and serotonin as brain control knobs. They adjust how much weight or precision we give to new evidence versus our prior expectations. This is core to Bayesian learning in the brain. Flashcard 2, dopamine the go. Signal. This system drives reward seeking, motivation, physical vigor, and what's called model-free learning, basically, learning from positive prediction errors, the good surprises. It can increase confidence and perhaps counterintuitively reduce impatience for larger future rewards. Flashcard 3, serotonin the wait stop signal. This system promotes caution, behavioral inhibition, patience, and learning from negative outcomes or punishments. It increases aversion to causing harm and tolerance for delayed rewards. It can also dampen sensitivity to both immediate rewards and losses in certain contexts. Flashcard 4, the dynamic balance. Dopamine DA and serotonin, often abbreviated 5-HT, have both opposing roles, like approach versus avoidance, and cooperative roles, like contributing to stress resilience via specific circuits. Their ever-shifting balance defines critical trade-offs, like exploration versus exploitation. Flashcard 5, precision pathology. When the balance is off, or the precision tuning goes wrong, it can lead to psychopathology. Examples include potentially overweighting negative events in depression, serotonin-related, or excessive overconfidence in mania, dopamine-related. Flashcard 6, confidence calibration. Our subjective feeling of confidence likely emerges from this dopamine-serotonin interplay. It reflects the precision weighting assigned to our internal models. Self-awareness of our state allows for conscious calibration, adjusting our confidence to better match reality. Flashcard 7. Circuit specificity is key. Remember, serotonin's effects are highly dependent on which specific brain circuits are involved. This cautions strongly against simplistic one-size-fits-all interventions or interpretations. Serotonin does many different things in different places. Flashcard 8. Moral alchemy. Serotonin levels can subtly shift complex judgments, like moral ones, biasing us towards harm avoidance. This demonstrates how these fundamental neuromodulators can reweight even our high-level decision policies and values. Okay, this has been incredibly insightful on a theoretical level, truly fascinating. The theory, as we always emphasize, is only as good as its application. So how can we, as rational agents trying to navigate the world effectively, actually leverage all this powerful knowledge in our daily lives? How do we move beyond just intellectual understanding?
This is indeed where the rubber meets the road. And the core idea we want to propose is a practical, structured, self-tracking tool. Let's call it the precision diary. Think of it as systematically performing Bayesian inference on yourself. You're becoming the scientist of your own mind. You're gathering data day by day on your own internal states, your decisions, and their outcomes, looking for patterns and correlations over time.
A precision diary. I like that. How exactly would it work? What components would someone track?
We can break it down into a few key components. It doesn't need to be overly complicated, but consistency is key. First, daily mood and energy logging. This provides a rough proxy for your underlying neuromodulatory state. Each day, or perhaps even a couple of times a day if you want more granularity, you'd record simple ratings, maybe on a 1-10 scale. Track things like mood, for example, from 1 very sad anxious to 10 very happy calm, arousal or energy level, raising a 1 very low lethargic to 10 very high wired, and maybe stress level 1 very low to 10 very high. These aren't precise chemical readouts, obviously, but they serve as remarkably useful indicators. For instance, consistently logging a state of being calm but having low energy might hint at a period of relatively higher serotonin and lower dopamine activity. An excited, optimistic state might suggest elevated dopamine or perhaps noradrenaline. A persistently anxious mood could point towards lower serotonin function or maybe high noradrenaline. Our software engineer, for example, after starting her SSRI, might consistently log something like mood, 7, feeling content, energy, 4, noticeably low, stress, 2, very low. That pattern itself tells a story. Second component, key decisions and outcomes. This is absolutely critical for linking internal states to real-world performance. You would log any significant decisions you made that day, and perhaps just as importantly, note any important decisions you found yourself procrastinating on or actively avoiding. For each decision point, note your subjective confidence level at the time. Again, maybe 110. Also note the time you took. Was it an impulsive snap decision, or did you deliberate for a long time? And if the outcome is known later, definitely record that too. Concrete examples might look like: proposed a new marketing strategy in the team meeting Confidence 810. Decided fairly quickly after reviewing data outcome. Team accepted proposal for trial, or on a different day. Deferred responding to that complex client email about the project issue Confidence 310. Kept putting it off all day due to uncertainty and feeling overwhelmed. Third component, subjective reflections. This captures your metacognitive insights, your awareness of your own mental state during those decisions. How did you actually feel while making or avoiding that decision? Did you notice specific sensations like hesitation, excitement, dread, or maybe a sense of flow? Were there any noticeable physical cues? Maybe an uptick in heart rate during a stressful choice, or a distinct gut feeling pushing you one way or another? These subjective experiences can often correlate with transient neuromodulatory surges like an adrenaline spike under acute stress, or perhaps a dopamine burst when something unexpectedly exciting or rewarding happens. And the fourth component, external factors, potential levers. This is where you track potential influences on your neurochemistry. Note things like your sleep quality the previous night, hours, interruptions, whether you exercise, significant aspects of your diet, eating a high-sugar meal, skipped lunch, and crucially, any substances consumed. This includes caffeine intake, any medications like the SSRI, alcohol, nicotine, etc. These all have known and often significant effects on neuromodulators. Over time, you might start to see patterns emerge. For example, perhaps I noticed that after a morning workout, which is known to boost both dopamine and serotonin, I consistently feel sharper and more decisive in the subsequent hours, whereas after a night of poor sleep, which often leads to overall low neuromodulation and impaired prefrontal function, I was remarkably indecisive and prone to errors.
Okay, that sounds like a really systematic way to gather personal data.
Yeah.
Once we've meticulously gathered this data for, say, a few weeks, how do we then go about making sense of it? How do we translate that raw data into actual improvement and optimization? What's the analysis process look like?
Great question. After you've diligently logged this information for a few weeks, enough time to start seeing beyond just daily fluctuations, you enter the analysis phase. You'll begin to actively look for correlations within your own data. Maybe you notice that your subjective confidence levels consistently track with your reported energy levels, suggesting a strong link to your dopaminergic tone on any given day. Or perhaps you find that your patience, or maybe your tendency towards impulsive actions, inversely tracks with your reported stress levels, indicating that when stress is high, serotonin might be relatively lower or less effective, leading to increased impulsivity. This systematic observation process is incredibly powerful because it helps you discover highly personalized leverage points, what influences your decision-making style. From there, you can start implementing tailored self-correction strategies. For example, if you consistently find that you become excessively risk-seeking or overconfident on days you log very high energy and optimism, a potential dopamine high signature, you can consciously implement a personal rule. On high-energy days, I must deliberately double-check any major decisions with a trusted colleague or wait 24 hours before finalizing. Or, if like our engineer, you find you consistently tend to avoid or endlessly defer decisions on days you feel calm but low energy, a potential high serotonin, low dopamine signature leading to analysis paralysis, you can implement counter strategies. These might include setting strict, non-negotiable deadlines for making choices, breaking down large decisions into smaller steps, or perhaps using predefined logic checklists or decision matrices to force yourself through the inertia. For you, our analytical listener, especially someone with an INTJ-like profile who thrives on systems, data, and self-optimization, this framework becomes an exceptionally powerful tool for generating personalized insight. It transforms self-improvement from guesswork into a data-driven process. It's important to remember that while the general trends we've discussed apply broadly across humans, each individual person has unique sensitivities, baseline neuromodulatory levels, and responses to external factors. Your mileage will vary. Let's take a specific INTJ example. An analytical INTJ, perhaps someone naturally inclined towards careful planning and less driven by immediate rewards, potentially reflecting a baseline disposition towards higher serotonin function relative to dopamine, might discover something interesting through their diary. They might find that on days they deliberately engage in a highly dopaminergic challenge, maybe playing a fast-paced competitive game, or consuming a significant amount of caffeine before a brainstorming session, they become uncharacteristically more impulsive or scattered in their thinking compared to their normal baseline. Noticing this specific personalized pattern, they could then strategically adjust their schedule or environment. For instance, okay, I'll schedule my detailed, meticulous planning tasks for my typically calmer, more focused days. And I'll reserve creative brainstorming sessions or tasks requiring bold action for days when I anticipate feeling more energetic or have intentionally used a stimulant, but I'll build in extra checks for impulsivity on those days.
That's fascinating. So this isn't just about understanding our current state passively, but actively using that knowledge to try and influence our chemistry more directly, perhaps without even needing medication or in conjunction with it.
Exactly. That's the ultimate goal. Empowered self-regulation. Being aware of these mechanisms and your personal patterns allows you to consider targeted interventions based directly on your diary insights. If you consistently find you're struggling with impulsivity, maybe making rash decisions, interrupting others frequently, or struggling to delay gratification, you could deliberately experiment with techniques known to boost serotonin or engage its associated pathways. This might include committing to a regular mindfulness meditation practice, taking restorative walks in nature, ensuring adequate tryptophan intake through diet, or, in some specific cases, and only under appropriate professional guidance, considering supplements like 5-HTP or St. John's wort with extreme caution due to interactions. Conversely, if you find yourself frequently battling apathy, procrastination, or indecisiveness, the state our engineer found herself in, you could seek ways to safely and appropriately boost dopamine function when needed. This might involve listening to intrinsically motivating or energizing music before a challenging task, setting up a system of small, meaningful rewards for completing specific goals, consciously increasing positive social interactions, which naturally raise dopamine, or ensuring sufficient intake of tyrosine, dopamine's precursor amino acid. This approach draws a direct, logical parallel to how pharmacological treatments work, but aims for behavioral or lifestyle adjustments first. Consider ADHD, for instance, which is often characterized by impulsivity and difficulty sustaining attention, linked to dopamine dysregulation. It's typically treated with dopaminergic stimulants like methylphenidate or amphetamines. It might sound paradoxical. Give a stimulant to reduce impulsivity. But the rationale is that in ADHD, impulsivity often stems from a low baseline dopamine level that makes it hard to feel satisfied or engaged with the current task, leading to an impulsive seeking of novel stimuli. The medication raises that baseline dopamine, helping the individual feel more focused and content with the task at hand, thereby reducing the impulsive urge to switch attention or act rashly. Similarly, SSRIs are often prescribed for conditions involving excessive impulsive aggression or debilitating anxiety, precisely to introduce more patience, restraint, and a generally flattened emotional reactivity, leveraging serotonin's inhibitory functions. The primary goal with the precision diary approach is to see if similar beneficial adjustments can be achieved through non-drug means first, by understanding and leveraging these same neurochemical principles through behavior, environment, and lifestyle changes. Finally, let's explicitly touch on risk calibration using the diary. If you diligently track your mood, energy levels, and confidence alongside your risk-taking behaviors, for example, investment decisions, proposing bold ideas, social risks, you may well confirm patterns within yourself. For example, you might find objective evidence that when you're feeling euphoric or riding a high after a series of whims, often a dopamine effect, you consistently tend to take unwise or excessive risks, perhaps underestimating downsides. Conversely, when you're feeling down or anxious, you might find you reliably avoid even smart, calculated risks that have a high expected value, paralyzed by pessimism. Equipped with this powerful personalized knowledge, you can then consciously correct for these predictable biases. On an identified up day, you might force yourself to conduct more thorough due diligence than feels necessary or seek skeptical opinions. On a perceived down day, you might consciously delay making major financial decisions until your outlook feels less pessimistic, unless delaying clearly incurs a greater cost. Over time, this practice of conscious hedging against your transient neuromodulatory states can significantly improve the overall quality and consistency of your choices. It helps ensure your decisions are more aligned with your true, stable values and long-term goals, rather than being unduly swayed by the temporary chemical winds blowing through your brain on any given day. #9. Designing your environment and routine.
That's a profound shift in perspective, moving from just observing to actively managing. And perhaps the ultimate rationalist move isn't just self-observation and self-calibration in the moment, but using that precise, personalized data to proactively design better conditions for yourself in the first place. How do we apply this knowledge to architecting our daily environment and routines for optimal decision-making?
This is truly where the systems thinking mind can shine, moving from reactive correction to proactive design. Once you start understanding your own typical neuromodulatory rhythms and sensitivities through diligent use of the precision diary, you can begin to intelligently design your environment and structure your routines to optimize your brain state for the specific types of tasks you need to accomplish. For instance, if you consistently identify that you experience a significant dip in energy and focus mid-afternoon, perhaps a time when serotonin might be naturally rising to induce sleepiness later and dopamine levels might be dipping after lunch, you wouldn't schedule your most demanding cognitive work then. Instead, you'd strategically schedule more rote tasks, administrative work, maybe exercise, or even just plan for short restorative breaks during that period. You'd save your most important complex decisions or creative brainstorming sessions for the morning, or whenever your diary indicates your individual neuromodulatory cocktail is typically more favorable for alertness, focus, and high-level cognition. Beyond just scheduling, you can also learn to subtly manipulate your brain chemistry in generally innocuous, everyday ways based on task demands. We know, for example, that exposure to bright light, especially sunlight, first thing in the morning, helps synchronize circadian rhythms and is known to stimulate the production of both serotonin and dopamine, helping to set a positive alert tone for the day. A carefully timed cup of coffee or tea before a particularly demanding meeting or focused work block can provide a temporary, useful boost of dopamine and norepinephrine, enhancing alertness, focus, and drive used strategically, not chronically. Conversely, perhaps before entering a potentially contentious negotiation or needing to deliver critical feedback, consciously engaging in a few minutes of slow, deep breathing exercises can gently nudge up parasympathetic activity, potentially influencing serotonin and oxytocin levels, helping to temper aggression or anxiety and promote a calmer, more measured, and socially attuned approach. These are subtle yet potentially powerful interventions grounded in neurochemical understanding. Now, it's absolutely crucial here to emphasize the pervasive concept of trade-offs. There is almost never a free lunch when it comes to manipulating brain chemistry or cognitive states. Pushing your brain deliberately toward one optimal mode, say achieving hyper-focused, goal-directed pursuit via enhanced dopamine signaling, usually means sacrificing something else. This could be reduced openness to new ideas, diminished peripheral awareness, less capacity for broad exploratory thinking, or perhaps even a decreased sensitivity to subtle social cues or potential long-term concerns. The truly optimal brain state is always context-dependent. A huge part of developing rational control, therefore, is learning how to appropriately match your brain state and using tools to help achieve that state to the specific demands of the task at hand. It's about dynamic flexibility, not finding one perfect state. Let's use some really clear, concrete examples of this state task matching. Imagine you need to brainstorm radically new solutions to a complex, ill-defined problem. This requires high exploration, creativity, and perhaps lower inhibition. You want to generate lots of diverse ideas without shooting them down too early. For this, a slightly dopamine-dominated, perhaps lower serotonin state might actually be beneficial. You could try to cultivate this by listening to upbeat, energizing music, perhaps having a strong cup of tea, engaging with an exciting or novel prompt, maybe even changing your physical environment to somewhere more stimulating. Now, contrast that with needing to meticulously proofread a lengthy, complex legal document for several hours. This task demands the opposite. High inhibition of distractions, sustained attention to fine detail, patience, and minimal errors. Here, a more serotonergic state characterized by calm focus and patience is far more advantageous. You could help achieve this by deliberately eliminating all distractions, ensuring you're not hungry or overloaded with sugar, maybe having a light meal containing some protein and complex carbs, as carbohydrates can facilitate tryptophan entry into the brain, modestly boosting serotonin synthesis, and choosing a quiet, stable, undisturbed environment. One could even speculate, looking further ahead, about broader applications of this thinking, perhaps in highly specialized team settings, although this requires a significant caveat about workplace dynamics and ethics. But imagine, for instance, a rationalist-minded team working on a complex project. Perhaps they develop a shared understanding and vocabulary around these concepts. Maybe they briefly and voluntarily share their perceived daily mode in a trusted setting. Just a heads up, I'm feeling a bit scatterbrained and low energy today. Might need someone to double check my detailed work versus I'm feeling really in the zone and detail-oriented this morning, happy to take on those meticulous validation tasks. While this level of transparency requires extremely high trust and a sophisticated understanding of individual differences, which the average workplace is likely far from achieving, for our specific audience, it highlights a fascinating potential long-term vision. Optimizing group performance through intelligent task allocation based not just on skills, but also on members' transient neurochemical states and cognitive modes. It's taking systems thinking to the team level. Hashtag outro and outro.
We've truly charted a profound and intricate landscape today. We've journeyed deep into the brain to understand the hidden chemical forces that are constantly, quietly shaping our daily choices, often operating entirely beneath the radar of our conscious awareness.
Indeed. And the core message, I hope, is clear. Dopamine and serotonin are far from being mere simplistic buzzwords for pleasure and happiness, as they're often portrayed. They are core, fundamental regulators of our brain's sophisticated decision-making machinery. They profoundly influence what we choose to pay attention to in the world, how we assign subjective value to different options and outcomes, how we navigate the crucial balance between short-term gratification versus long-term rewards, and critically, how effectively we control our impulses and inhibit inappropriate actions. True rational control of our behavior, that elusive ability to consistently make decisions that align with our overarching objectives, values, and principles, deeply depends on these chemicals being in a delicate, dynamic balance and being properly tuned to the specific context and demands of the moment. By examining these diverse perspectives today, from compelling clinical observations like our engineer's story to the mechanistic details of specific brain circuits, all the way to cutting-edge computational models of the Bayesian brain, we gain a far richer, more nuanced understanding. We understand why we sometimes deviate from pure, abstract rationality, recognizing that perhaps our brain's internal precision settings might simply be temporarily off or mismatched to the task. And, most importantly, we gain insights into how we might consciously work towards improving that calibration.
And the narrative of our software engineer, the executive struggling with SSRIs, really brings home the personal stakes involved here, doesn't it? Understanding the science helps us realize
perhaps with some humility, that tweaking these powerful neuromodulators, whether through intentional means like medication or unintentionally through stress, diet, sleep, or other lifestyle choices, can subtly but profoundly change who we are at any given moment. It can make us kinder, but perhaps less ambitious, or bolder, but potentially more erratic. It's about recognizing and navigating the nuances of these shifts within ourselves.
And this is precisely where the concept of the precision diary emerges as such a potentially powerful and empowering tool. It's not about pathologizing normal fluctuations, but about enabling a systematic self-observation. It empowers us to notice these shifts within ourselves and, crucially, to consciously adjust for them. It allows us to approach our own internal neurochemistry not as some mysterious black box or an immutable destiny, but as an integral part of the environment in which our rationality must operate. It becomes a landscape we can learn to map, navigate, and even subtly influence over time.
And for you, our analytical listener, with your innate penchant for self-optimization, your drive to understand systems, and your systems thinking approach to the world, you can truly leverage these insights to fine-tune your life. Think of it as a form of metacognitive ergonomics, intelligently arranging both your internal state, through awareness and targeted behaviors, and your external environment so that your mind's natural chemical tendencies work with you rather than against your most important goals. It's about optimizing the very machinery of your thought processes.
And let me offer just one final, perhaps somewhat philosophical, thought-provoking insight to leave you with. Realizing that what might sometimes feel like a deep personal flaw, maybe you beat yourself up thinking, why am I so scatterbrained today? Or why can't I just make this decision? Could actually be, at least in part, a reflection of a transient neuromodulatory state. Well, that realization can foster much greater self-compassion. And indeed, perhaps greater compassion for the apparent inconsistencies we see in others, too. It encourages a more scientific, less purely moralistic view of our own cognitive performance and limitations. Now, importantly, this understanding isn't intended as an excuse to relinquish responsibility or control. It's not about saying, oh, well, my dopamine made me do it. Absolutely not. Instead, it becomes a powerful prompt to apply the right tools, the right strategies. It shifts the internal dialogue to something more constructive, like, okay, my dopamine levels might be low this afternoon, contributing to this lack of initiative. So I'll consciously use a specific technique, maybe break the task down, or promise myself a small reward to help boost my focus and motivation for this next crucial hour. Over time, the patterns you meticulously track and analyze in your precision diary can reveal which personalized strategies truly improve your decision quality, your focus, your mood regulation, your overall effectiveness. It transforms your life into an ongoing, personalized experiment in living well, with you acting as both the dedicated scientist and the fascinating, ever-evolving subject.
Ultimately, what we've discovered today exploring the intricate, ceaseless dance of dopamine and serotonin is that so much of effective functioning boils down to achieving both precision and flexibility. The precision to confidently act, to exploit known good paths when the evidence warrants it, and the flexibility to reconsider, to inhibit, to explore new avenues, or to adjust your course when circumstances change or uncertainty is high.
By truly understanding this remarkable neurochemical dance, we become better, more skillful choreographers of our own thoughts and actions. We can aspire to cultivate a state of dynamic neuromodulatory harmony where our confidence is appropriately calibrated to reality, where our patience and impulsivity are dynamically balanced to the demands of each situation, and where the risks we choose to take are taken with clear eyes and a well-informed, well-regulated mind. In the grand, ongoing quest for rational control and effective living, appreciating the profound and distinct roles of serotonin and dopamine is arguably one of the most powerful steps we can take toward mastering the art of decision-making itself.